are the folks that are casual drug users on a weekend.
Sure.
And a couple of things with that. One, they ought to be testing their drugs.
Mm-hmm.
Because now 60% of cocaine is laced with fentanyl, according to law enforcement. If these people aren't testing their drugs, then there's something wrong with them. I'm Flindt Andersen, founder of PAIN, Parents and Addicts in Need. I've been in recovery since 2001, and there isn't much I don't know about recovery. And my mission is to constantly tell the truth about addiction, to make the realities of addiction, recovery, and drug culture known, and to drive awareness and advocate change that ultimately saves lives.
And I'm Jason LaChance, a certified recovery coach with a passion for speaking with others and sharing their knowledge to help others seek recovery and maintain long-term sobriety. And this is the Don't Hide the Scars podcast, presented by PAIN, Parents and Addicts in Need. Whenever I'm ready, whenever you're ready.
I'm ready.
Okay, founder of PAIN, Flindt Andersen is ready. Jason LaChance here. Thank you for tuning in or watching. Don't Hide the Scars. We definitely appreciate it. And hey, if it's your first time, hit that subscribe button. And please, if you get value out of it, share with others. Wow, Mr. Andersen, as the year comes to an end, we're getting closer. We got so much we want to talk about in so little time.
Yeah, because this is going to be, I would say, head and shoulders above what we are going to go after starting the first of the year, because it needs to be. You know, as you well know, I have been fired up for at least the last 30 minutes or so.
What are you talking about? It started over the weekend with the text message.
It did. Yeah.
This is 4 days later.
Yeah, it did. That's right. I forgot about that. Yeah, because look, there's a couple organizations out there that have sent me over the edge on this thing. And one is Drug Policy Alliance. The other one is a company called dancesafe.org. These people, I can hardly even describe them.
Sure.
I'm beyond upset at these people. I think it's pretty typical of what is going on in our society today.
Right.
You know, and yeah, there you have it. I mean,
yeah, I think, you know, when we were sitting and I was thinking about this is that, you know, when we read a lot of the rhetoric or their logic, justification, whatever you want to call it, for how they support the statement, their statement, not ours, support the drug user, right? Wasn't that what was on one of the things?
Support the drug user and support the drug dealer.
Yeah. And it's like, I get we want to support people in different lifestyles, but you get, you know, people, this is life and death stuff.
Yeah.
And it's, you know, I was sitting thinking to myself, is it who really is putting this out? And then I'm thinking, okay, who's to gain money off of this perspective? Because I don't think a drug user even would put this together.
No.
This way.
No.
Yeah.
And speaking of money, I read where they've from donations, they've raised over $13 million.
Holy heck.
You know, what are they doing with the money besides buying fentanyl test strips and putting out bullshit? Okay, that makes absolutely no sense at all. I'm sorry, to a normal human being.
No, we have the directions here.
We got them all.
You have the original packet, but we're talking about fentanyl test strips, and it's like 4 freaking pages of this stuff.
Well, yeah, I mean, if you just take a look at this thing,
yeah,
okay. I mean, first of all, let me explain the addict, because I am one, and I don't know where these people get their information. As a practicing addict, whether you're on the street, live at home with your parents, live in an apartment, doesn't matter. We have one major concern, that is having enough drugs for the day so we don't go through withdrawal symptoms. End of story. There's no other thought pattern in our head. If there is another thought pattern, the second thought is, what am I going to do for tomorrow? Those are the only two thoughts. Now, once those drugs get in our system, Then we can kind of meander through the day a little bit to get a couple things done here and there. Again, unless we're just so destroyed by fentanyl and all its properties that the only thing we can do is manage to stand up from time to time. So the last thing that the addict is going to do is test their fentanyl or test their drugs. And let me tell you why. Once we reach that point of withdrawal symptoms, we don't give a damn, like I said, about anything except getting that drug in our system and as quickly as possible. Now, if we are already fentanyl users, we're not going to waste the time. We're not going to sit there and let me just read this. By the way, if somebody is trying to test a pill for fentanyl, no addict under the sun is going to waste a pill to test it. Mm-hmm. I'm sorry. Mm-hmm. It's just not going to happen. I don't know what these people are talking about. So let's take the person on the street who probably has no water, no shelter, no anything, right? And they want them to crush the entire tablet into a fine powder. They want to pour the powder into a small cup. Where are they going to get a cup? Add the appropriately 4 tablespoons of a 1/4 cup of water. Now, let me add that most addicts on the street will use gutter water.
Yeah. I mean, you and I've known heroin addicts. That's what they use to mix.
You bet. You bet. Ask Tony Hoffman.
Yeah.
Number 4, stir the mixture well and hope for the best, I guess.
Right.
Okay. They tell you how to test it for blottered LSD. Let's see, for crystals or powdered drugs. It's preposterous to think that a full-blown drug addict is going to take these steps to do it. We've tried it. We've tried opening the packages. They're shaking so much. How are they going to get the packages open?
Yeah. Well, and I mean, you've dealt with it more than I have, but I've definitely been around it and grew up in a home with someone who used methamphetamine. You're still out of your mind. This is not a logic that you're going to even think. It's not going to happen.
It's not. Now, I will say this, and I've said it before, and I'm going to continue to say it. Most of the overdose deaths that are coming, or that have come, are the folks that are casual drug users on a weekend.
Sure.
And a couple of things with that. One, they ought to be testing their drugs. Because now 60% of cocaine is laced with fentanyl, according to law enforcement. If these people aren't testing their drugs, there's something wrong with them, right? But going back to the addict on the street, or just the addict in general, because these people say that every overdose is an accidental overdose. Sorry, folks, that's not the way it works. That's not the way it works. A true fentanyl addict, a true opioid addict knows exactly what they're taking. They know exactly what they're buying. And yeah, they don't know the amount, especially with fentanyl now, because it's changed the game so much. They don't know the exact amount that is in there. But as a recovering addict that was in that position, I guarantee you we're going to take the chance every time. Every single time. And I'm going to use another example of a person who I know was using something for quite a long period of time and wound up dying from an overdose. And this person, let me put it this way. There's no way under this earth that he would not have used any drug and didn't care what was in it.
Yeah, he was one of the garbage can. people.
Yeah. So again, and again, as an addict, I've said this before, we are in such a state of, I can't even think of the right word, of disarray, of confusion, of guilt, of shame, of all of that stuff. People got to trust me when I say this. I thought it myself. There are worse things than death.
Mm-hmm.
And living like I was living, I didn't want to live anymore. It's not that I necessarily wanted to die, but in my mind at the time, there was some relief in that.
Sure.
Again, I would have never put a shotgun in my mouth. I would have never slit my wrists. I would have never hung myself. I would have never done that. But yeah, if I happened to overdose, well, so be it. Because the life I was living, like every other addict out there that's in this full-blown, sometimes we don't care if we live or die.
Mm-hmm.
And again, I'm going to go back to a lot of the advocates that are out there. They're advocating for this free will bullshit. And a lot of it is because they lost somebody.
Yeah.
And now they're in their head, their thinking is, if we only would have just kept them alive longer. And yeah, and I see that. I see that. But dancesafe.org, Drug Policy Alliance, and we'll get into some of the other things that Drug Policy Alliance wants. It's like they just want to keep everybody high and happy.
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com.
Yeah, there's nowhere in any of this at any point, looking through it, I don't see, even the fentanyl test strip references carrying naloxone, Narcan. We'll get to that in a second. But at no point that it's there's not anything. If you question if you are an addict and struggling, here's a way to get help. None of this stuff ever includes that.
Exactly. And Jason, we are looking at documentation right off of their websites.
Yeah. Yeah.
It's like a lot of advocates out there today. Where are they trying to change the treatment system? Where are they fighting for, arguing with politicians, doing those things that are trying to get the treatment system fixed? And again, I'm not talking about private treatment. It's two separate things. It's government treatment and it's private treatment. Why aren't they stepping up? When we go to Sacramento, I don't see anybody else, at least from the Fresno area there.
Mm-hmm.
And by the way, ladies and gentlemen, we have people in Fresno right here, right now, that believe in this crap, okay, that I'm reading about. Do you know what? I mean, do you know what this even says to law enforcement? Basically says, go fuck yourself, law enforcement.
Mm-hmm.
And you and I both know these people that are in law enforcement and doing this work.
Yeah.
It's
the funny, forget the man, down with the man.
Right.
We ain't going with your control mechanism, but you're going to go for the ultimate control mechanism,
there it is.
which is addiction.
Right.
I mean, talk about a way to have everything about your essence and being, your spirit, your mind, your body, completely hijacked and controlled by something.
Yeah.
So it's we don't support that. we don't want the control over here, but we're fine with this over here. It's this the other people choosing, thing that's going on.
Yeah. Yeah.
It's like, no, we can't have always.
You can't.
There are situations where I'm sorry, not all options are gonna work. That's just not.
That's right. They're just not. I mean, as I'm sitting here and I've read this stuff earlier and I'm reading it now, I mean, look, rethinking and reducing punishment of people in the drug trade. That's talking about drug dealers.
Right.
Most people agree that drug use should be treated as a health issue instead of a crime. Yet, many still support harsh punishment for people who sell drugs because of stigma, ignorance, and fear. The Drug Policy Alliance is advocating for new responses to drug sales that improve public health and safety while reducing punishment. How in the fuck do you reduce public health and safety by allowing a drug dealer to sell on our streets?
Yeah, especially as we know, and the literature and all this acknowledges, okay, accidental overdose. Let's call it a poisoning. Let's call it what it is. It's a poison. This is a poison.
It is.
And one of the things that offends me, you get the color version there. That guy, that's Prince right there. They make a reference to Prince dying of a fentanyl overdose. Prince wasn't getting illegal fentanyl. This is before the knowledge for people that were prescribed. Like Tom Petty was not getting illegal fentanyl.
Right.
This is the stupidity of what these people fucking put out here.
Right.
That it's understand those two individuals, not illegal, and understand how addiction works, how addictive it is.
Yeah. Prince
had just performed a show.
Right.
Gone.
Right.
Tom Petty, not long before.
Right.
Gone. Okay.
Yeah.
This is how strong it is. And you want to put out this little kit to test it. Are you kidding me?
Right.
I get it. Like you said, for the casual user, we know stories of people buying cocaine, MDMA, whatever it is, and they didn't test it and they're dead. I get it. Those people, yes, you should, if you're really going to go that way,
right? As
if you think that's a necessity of life. Okay, whatever. It's your thing to explore. But understand this, especially with fentanyl. These are not people that were illicitly getting this drug.
Right.
That is how strong it is.
Right.
And they were prescribed it for pain.
Right.
Which my understanding now, it's only prescribed to people like end-of-life cancer people.
It's prescribed for end of life, but it's also used in surgical procedures.
Right. Which we both have had.
Right. Right. It's beyond me that people can even go down this road. They want to legally regulate drugs. I mean, they want to not punish the drug dealer.
Right.
Do you think that the cartels give two shits about this?
No.
Of course not.
No.
Cartels are going,
yeah, right?
Yeah, go for it, Drug Policy Alliance, because we're going to make more money off you.
Right? Yeah, think about it. Like, hey, your best hookup over the border. So, it's the cartel group in Mexico. You got your best hookup over the border. The guy that's doing the best work, he gets busted. And instead of serving life, he's now out in 5 months.
Yeah.
If that.
Yeah. If that.
It's a very sunshine and rainbow approach to this thing.
Yeah. And I've about had it with rainbows and sunshine. Believe me. It's people need, there's another one. People need to support, not punishment. The decision to punish drug use has affected nearly every aspect of life. The drug war has now spread beyond the criminal system into education, employment, housing, and more. The Drug Policy Alliance is working to end the punishment and surveillance that harm families and communities. Well, let me tell you something. Let's just take the employment side to this thing. Mm-hmm. Everybody knows I own a treatment center. Everybody knows what we have going on here at Payne, and will say it. I do not want an employee that is high. All right. Do not want it. So as long as you have, okay, there's another thing here. Overdose prevention centers. No one should die from a preventable overdose. Overdose prevention centers save lives. They are much needed response to the unprecedented numbers of Americans dying from overdose. Overdose prevention centers reduce overdose death and connect people to ongoing care. Okay, let me tell you something. That in its statement right there. Okay. There's some of it's okay. Some of it to me is not. Okay. But I agree. No one should die from an overdose.
Mm-hmm.
I agree with that. Nobody wants somebody to die. Nobody wants somebody getting HIV or Hep C or anything else from a dirty needle. But you're not good. If an addict or somebody that's even not an addict wants to get high and use, they know the dangers going in. They know the dangers going in. If they don't, they've been living on Mars their entire life.
Mm-hmm.
Every time somebody drops a pill, every time somebody shoots up something, okay, everybody is at risk of an overdose. And people know exactly that.
Yeah.
So now they want to put in overdose prevention sites. By the way, who's paying for all this?
Well, it's not just that, but okay, well, so what's your location? And really what does an overdose site really do? Like, okay, so my buddy appears, he's foaming at the mouth. Do I somehow load him in my car and take him to your overdose? What do you mean for an overdose site? What does that even mean?
Right. I don't know.
What does that mean? A place where people can walk in and get educated? All right, good luck with that.
Good luck with that. Right.
I how many people are just, overdose prevention site. I'm going to go on in there and explore what this is.
Yeah.
It's
like, are you kidding me?
And when it comes to like the criminal stuff, the thing that I keep over and over seeing that we've heard, you and I have, the Portugal model. Yeah, really take a look at it, because
got to take a look at it.
Yeah. If you are a drug trafficker, you still serve some time.
You bet.
And when it comes to the drug addict, yes, they won't throw you in jail. Yes, you will get put to a program. But guess whose responsibility and all of a sudden is incorporated with that drug addict's rehabilitation? Their family. Yeah. And it's made clear this is falling on you, this person, because it's not like you can go in Portugal over and over and over again and violate these policies and never go to jail.
And by the way, before they put all this into place, they had developed, I'm going to probably get the number wrong, but something like, I'm going to say something like at least 100 treatment facilities around the country before they went down this road. So knowing that, hey, we do have places for people to go. I mean, again, we're looking at this drug policy alignments, community reinvestment. Communities need resources to thrive. The U.S. government spends billions each year enforcing drug war prohibition. This money can be better spent supporting communities. This includes addressing the root causes of problematic drug use. The Drug Policy Alliance believes we must reinvest funds back into the communities most harmed by the drug war. What we need to invest in is we need to invest in treatment facilities, by county-run treatment facilities, so we can offer these people a place to go.
Yeah.
And a place to at least give them the opportunity to get clean if that's what they want.
Yeah. Well, and they're
reinvest in what?
Yeah, they're not wrong in the part where it talks about, let me see where that one, where we
right at the bottom.
Yeah. This money can be better spent supporting communities. This includes addressing the root causes of problematic drug use. Well, I guarantee you, if you continue to support the drug user to continue to use, they are never going to address those underlying problems.
Ever. I'm just baffled, right, by these people and what they're promoting.
Yeah.
And it seems like they've got a pretty large following here, which scares me even more.
Sure.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.
And then you have dancesafe.org, who, look, folks, they're event planners, they're party planners, they're event promoters.
Mm-hmm.
What do they know about any of this other than they don't want somebody dying at one of their events?
Yeah.
So they're handing out fentanyl test strips and Narcan. And just a quick side note, when and both these places, when they start talking about Narcan, and they're saying it like this: please carry Narcan with you. Well, that implies to the person that you're able to self-administer Narcan. Sorry, you're not.
No.
Okay.
No. Watch a video when someone is on fentanyl and how quick they nod out.
Gone.
Faster than heroin.
Gone.
Yeah.
Right. There's not a chance in hell that's going to happen. You know, again, it seems to be that they're trying to use these things as, quote, treatment tools.
Right.
You know, and they're not treatment tools.
Yeah, the brain's just not going to. None of this is going to click with that individual, that user at any point. It's just not.
No, it's not.
They might have a moment of clarity, but that moment of clarity has to be where they can then get into a place and then see a different wave existing and take a look at, yes, whatever is those underlying issues and things of that nature.
Yeah.
I mean, I get it, but like, well, okay, if it's an impoverished area, you know. What are you going to do? What is this organization going to do for an impoverished area?
This organization, to me, doesn't seem like it's got any answers at all.
No.
Don't let Congress ramp up the drug war by increasing penalties on fentanyl analogs. In my opinion, what this is stating is saying, let's not punish China for shipping the fentanyl analogs into Mexico.
Mm-hmm.
Well, guess what? Now that the president of China is in San Francisco, maybe they can talk about that and say, no, we're not going to charge you guys for doing. I mean, what bullshit?
Yeah, who's like? I think you said they have something like $13 million in. Like, who's majorly contributing to this? Is it these companies that create these precursor chemicals? Like, who is it that's like really wanting to put this out?
I mean,
what do you buy?
I mean, don't let Congress ramp up the drug war by increasing penalties for fentanyl analogs. Again, that's telling me that we shouldn't go after China. By the way, I didn't see the full report, but a few nights ago, there was something on ABC News about they are starting talks with China about the analogs and shipping them from China.
Yeah, I wonder if that's a part. I always get it wrong. Xi Jinping, right?
Yeah.
Here in the States right now. I wonder if that'll be a part of that conversation. Hopefully it will.
But isn't it amazing, on a side note, that they got everybody off the streets of San Francisco in a heartbeat because this asshole's coming to town?
I'll see if I can find this photo and pop it up for the people that are watching. But yeah, so what would he be? The prime minister of China? I forget what they classify their leader as, but
for life.
Yeah, he's here in the United States, so San Francisco, all the homeless stuff. Not only did they get the people off the streets, washed it down.
Oh yeah,
but now they put up fencing too, to where they can't go back.
Yeah.
So it goes to prove, hey, we can do it. We can do it really fucking fast.
Oh yeah,
because I like to think that the people have been put somewhere that it's not a nefarious, just taking them in their tent and dropping them in the desert.
Right.
We would like to think, but will we know? Who knows?
Right.
Hopefully we can get an answer to that one.
Right.
So it's possible. And it also proves that you don't believe the bullshit rhetoric that you've been putting out there of we need to just let them go and exist. If that was the case, then you would have left them right there and went, leader of China, this is how we let our people live. Right. Are you fucking kidding me?
Right.
It's once again that you are full of shit. I'm sorry.
Right.
You're going to tell everybody to shelter in place and don't go out, but you're going to have a group of your friends maskless at your restaurant.
Because the first thing I would have done is I'd have left everybody on the street and I would have taken Xi Jinping, whatever his name is, all right, I'd have marched his happy ass right down in the middle of that and say, this is what you've created.
Yeah.
This is what you've created. And he would probably be thinking in his own head, yeah, I did. And guess what? I'm making billions of dollars off you guys.
Yeah, quite possibly.
I mean, it's just we've gotten to the point in this where I mean, what's it going to take? What's it going to take for some actual change here? Like we've said in the past, we've got ideas. We've got some solutions to this, but it has to start. Again, it's just me. It has to start with treatment. I've been at this so long. I was in addiction for so long. We all think we can do it on our own. We all think we can titrate down from something, right? And I'm sorry, maybe 5% of us do it that way and make it.
Yeah.
Maybe.
Yeah.
But again, if I'm an employer, and you can be an employer in any position. Maybe you're working in the tech industry. Maybe you're working in the medical industry. Maybe you're wherever it is. Do these people realize, I'm going to get the numbers wrong, but you'll get the gist of it? I did some research one time on what it cost American business every year in the United States. And and I'm not exaggerating, it was well over $1 billion a year. Lost wages, lost time, firing, bringing somebody else in. It cost American business billions of dollars every year when you've got employees that are high. And like I told you before we went on air, a few years back, I'm driving down the street and I hear of two buildings in Pennsylvania. Can't remember the city. Could have been Pittsburgh. No, I'm sorry. Maybe it was Philadelphia. And this guy screwed up the crane, and the crane goes into one building, knocks down another. I think 2 or 3 people were killed. And of course, my first thought, is, okay, is this guy high? And sure enough, in the next couple of days, opioids and marijuana. You don't think that company was sued? Mm-hmm. I would be surprised if they even stayed in business after that, because I guarantee you the lawsuits were many. Now you're talking about death, property destruction, all of it.
Yeah.
Wow. I mean, for them to even make this statement, maybe Drug Policy Alliance, you want a bunch of high people running around your office. Well, good for you. You're probably a nonprofit. You probably ain't paying them for shit. Okay, so you don't care.
Well, and I'm tired of we haven't heard anything on a national level from the government about this at all. And don't sit and tell me it's a money issue, because we just acknowledged that we overpaid the Ukraine by $6 billion.
Yeah.
And it was just, it's going to work out for a future payment. Look at how much work can be done on this issue with $6 billion. So stop telling me that it's not there.
Yeah.
And hey, I don't disagree with you. Obviously, societal things lead to a lot of this stuff. You're telling me the $6 billion can't go to improving neighborhood schools,
right,
after school opportunities for our youth and everything else? Bullshit.
Right.
But there's no money with it. And if you don't think some people with a lot of power are making a ton of money off of that extra $6 billion going to the Ukraine, that it's just, we don't want them to die and we want them to be good in this war. No, bullshit.
Right.
No, it's not.
Any war, the government makes lots of money.
Oh, yeah. And then, of course, all the private companies. And if you do, we're not that podcast, but you follow the money. I'm pretty sure Biden owns some stock and some arms.
Oh, I would venture to say yes.
But yeah, so don't tell me that the money's not there. It's just that there's nothing for what should be your constituents. But no, it's the people that support your campaigns and everything else and have a lot of control over you and probably a lot of information on you. Yeah. So the money's there, but you're not going to do shit.
Yeah. I just keep wondering, how do people get caught up in this, that Well, first of all, how do those people that they get caught up in these companies like this, and don't really understand the root issue here? Does that make sense?
Yeah.
It's like these things seem to be just like dancesafe.org. I mean, who are these people? You know, you may have to edit this, but you know, when I saw the picture of all the people of dancesafe.org that they published, they looked like they all came out of, for those of you that don't know who Timothy Leary was, he's the inventor of acid, LSD. All looks like they came out of his bus in 1965.
Right.
Not trying to put down somebody the way they dress, but they all looked high. They all looked, I mean, just out there.
Yeah. Very, very peace and love.
Right. And again, I don't have a problem with peace and love. I mean, I don't.
No.
But my God, I mean, does everybody want to live in this utopia of peace, love, rock and roll, and let's get high and everything's going to be fine? I'm sorry, gang. Addiction doesn't work that way. You want to hide from society? I don't even have a problem with that. Go hide somewhere. But my God, I mean, it's not what these people are doing is not for everybody either.
No. Mm-mm.
But when you're addicted to a substance and something like this comes along, most of us are going to go, yeah, this is going to give me the freedom to keep going the way I want to go. So dancesafe.org, Drug Policy Alliance, all right? Are you thinking about the families of these people?
Mm-hmm.
And the families that are torn apart by this?
Mm-hmm.
And you want to keep these people going the way they are?
Mm-hmm.
Most people that are in addiction, if given the opportunity to go to a proper treatment center, will take it.
Mm-hmm.
Now, I have to say, when it comes to the money piece of this, I don't believe that everything needs to be free. I believe there has to be at least something given back by the addict.
Mm-hmm. Absolutely.
And if we're giving them treatment for free, then let's require them to do some sort of public service work or something, you know, for a year or two while they're in their recovery to give that back.
Yeah.
Because it's also good for the soul to do that.
Yeah, it's an imperative part of the process anyways. You know,
you bet.
I don't care if you were an addict for 6 months, you've been taking from the world in one way or another.
You bet. You bet. So again, to these two places, what are you building here? What are you telling these people that it's okay to just continue to that's what they're telling them. Yeah. Do what you want, act like you want, be what you want. Well, let me tell you something, folks. If they continue to do this, you're going to wind up with more overdoses.
Yeah.
You're going to wind up with more addiction. But they're going to say, well, it's their choice.
Right.
Yeah, but you're promoting it and you're condoning it and you're letting these people get away with it when, in fact, you've never even given them the choice of going to treatment or not. Yeah. So you can take all this paperwork, guys, and you can shove it up your ass.
Yeah. Yeah, because either site, and we've gone through either of them, that there's nothing of any language of any kind that's like, I acknowledge I'm an addict and I want help, and not even a button to the shitty program that you and I called the national number, then that put us local, then put us on hold for a half an hour, and never got us to if you are in need of inpatient treatment. So none of it's connecting to any of it. So for me, you know me, I'm like, okay, let's follow the money on this thing.
Sure.
Because none of this. So like, what are you guys contributing to when it's, you're clearly not helping someone get in there. Are you helping the family with their funeral costs?
Right.
With your profits?
Right. Great point. Great point.
Yeah. Because I don't know if they're both nonprofits or whatever it is. Doesn't mean you're not bringing in the money.
Absolutely.
And that somebody's not being paid well.
Absolutely. And also, what? You think with everything that they're doing that this doesn't affect the American consumer? Of course it does. Our taxes go up. Everything goes up. And again, as an American citizen, I don't mind paying some taxes to help somebody. I will not pay for this.
Yeah. As a matter of fact, please start using my tax money to help
the correct
somebody.
way. Right. I got no problem with it.
Right.
None.
Yeah.
It's sort of like welfare. I mean, FDR started this thing, all right, to help somebody. It wasn't meant to be generational. And no American has a problem with helping somebody that's down on their luck. I want to make that real clear.
Yeah.
None of us do. But to keep paying for it over and over and over again.
Yeah.
That's just flat ass wrong.
Yeah.
So these people that are running these organizations, they need to be looked into. I'd love to see what their books look like. I'd love to see the salaries they're making and say, okay, why? And again, going back to the very beginning here, why aren't these people, including people in Fresno and Bakersfield and all around this valley, because this is what we truly care about here is our valley.
Yeah.
Why aren't you guys out there trying to help change the system to get some treatment places back in shape again and enough of them to where we can start to help these people?
Yeah. Yeah.
Enough of this, man.
Yeah.
I mean, I've had it.
Yeah. Well, and my last comparison here is, I remember, well, you use a condom, safe sex. And I had a very excellent sex ed teacher in high school. And he said, there's no such thing as safe sex. Well, I'm here to tell you people there's no such thing as safe drug use. Not with these test strips or anything else. You know what? I got two buddies. Yeah, we did use a condom. Broke or whatever it was. Now, parents have been since high school or whatever it is. Same thing here.
Right.
But guess what? This one doesn't create a life. It takes that life.
Right.
So you can go ahead and test.
Right.
And guess what? There's people that have tested their cocaine. Well, because you're only testing such a small area, it wasn't where the fentanyl was.
Right.
So
these are let's make that point real clear. These are not foolproof.
Yeah, this doesn't make drug use safe. There's nothing safe about using illicit drugs ever.
There's nothing safe even about using a fentanyl test strip.
Yep.
I would love to know, because I don't know, and I'll admit when I don't. All right. I don't know what the percentage is here of this thing working and actually testing, I mean, because you're right. They're not testing the whole batch.
Yeah. Did you notice the language in it? It doesn't reference the harm of a false negative. It ensures not having a false positive.
Really?
So so they're more concerned with making sure that you're cool. Like, hey, you can go ahead and get fucked up.
Wow, I didn't see that.
It's not
part.
like, hey, be aware. This could be a false negative. Understand that responsibility still falls on you. That's what I'm saying. They're like a condom company. They're like, look, hey, we make what we make. You put it on wrong, user error, whatever. Right. You then got little Johnny.
Your cat gets into it and tears it out.
Yeah, right. You had it in your wallet a little too long or whatever it is.
Right.
It's the same with like if you think, birth control or whatever it is. Oh, wow. Your doctor didn't tell you that if you took antibiotics with that, it was going to lower your risk. Got another paraphernalia, same thing happened.
Wow.
It's same thing. This is the same thing.
It is.
You're not mitigating all risk. You are hopefully lowering that risk.
Right.
But I'm a fentanyl addict. I don't care. I'm not. Matter of fact, what would I be testing it for just to guarantee that it was fentanyl?
Yeah, right. Like, it's fentanyl. It's what I wanted. Yeah. Here we go. Right. I mean, my God. Anyway, it's This was something we needed to bring up. This is something we needed to talk about. This is something that we're going to continue to talk about. And I'd love to get these people on the show. And I'd like to get our law enforcement people in here with us to do it, because this, to me, again, and I think one of the most appalling pieces to this thing is the fact that they don't want to prosecute drug dealers.
Yeah.
I think that's just.
Ask Dana Carvey and his wife how they feel right now.
Yeah.
And then the other nameless families, because they're not celebrities and so on.
Right.
That in the last few days.
Right. Yeah. No, that's a very good point. Because that's the reality of this.
Mm-hmm.
I don't know. When they sit here and they say, well, we've lost people. They admit on here, we've lost people. I can't remember all of it, but they also say we use drugs. Well, what are you doing?
Yeah.
Pick a side.
Yeah.
You can't have all.
Yeah.
It just doesn't work that way.
Never has, never will.
So for Drug Policy Alliance and dancesafe.org, good luck to you, because we're not going to stop.
Yeah.
And we're going to get some people in here, and we're going to start talking about this stuff. And we're actually going to start doing something here. Yeah. We have to start calling people to the mat on this. Okay. Enough of the almost like genuflecting, it's, we're talking about this and we're talking about that. And, we're good people, or, horse shit. Okay. Get in the gutter.
Yeah.
Get in the trenches. You want to join forces with us? Great. Okay. But if you're going to do this crap, get out of my way.
Mm-hmm.
Get out of our way.
Mm-hmm.
Because something needs to change here drastically, because it's simply not getting any better.
Yeah.
And I will just end by saying this. There has not been a lot in the news recently over fentanyl or any drug issue, simply because the war that's taken place. And we cannot forget that this war, the fentanyl, opioid, substance use, methamphetamine wars, that's on our soil.
Mm-hmm.
And that is our war right now. And that's a war that continues to need to be fought. It's a war that, again, I wish I didn't have to say this, but I don't think we're ever going to win. But we could certainly win some battles here.
Yeah.
Because we are a nation of free will. You're never going to win everything. But again, it's simply let's give our people an option. Let's give our people a choice.
Yeah.
And if that addict doesn't want the choice, then okay. But don't be a burden on our system. Don't be a burden on those of us that want to help you, and now you're turning it away, but expect us to pay for it.
Yeah. Mr. Andersen.
Mr. LaChance.
Thank you as always. Good
as
sir.
always, my friend. Appreciate you.
And thank you for either listening or watching Don't Hide the Scars. Again, please hit that subscribe button if it's your first time. And please share with somebody else. We don't really advertise the podcast other than on our social media. And we need your help. So spread the good word.
Thanks.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.